Following on these concerns that have been voiced, we do know that a lot of issues are raised from baseless information, misconceptions, or simply fake facts. So we've got some questions surrounding this, and Tarique has a question for you with question number 8.
Thank you, Alex. So, Professor, during the outbreak of this pandemic, we have been given a lot of advice, and this has either been spread by a word of mouth or through different media platforms and social media platforms. And at many times, this advice that we have been given tends to contradict one another because some of them can be good advice that is quite useful, and some of them can be advice that tends to make the situation worse. So, as you said earlier, the wearing of face masks, sanitizing our hands. But then we were also told that the virus can be spread through saliva droplets in the air and that the virus is airborne. And at some ridiculous point, I don't know who came up with this, but we were told that we had to drink bleach to cure the virus. And for those that have been infected, we were told that the facilities that are meant to contain these people with COVID-19 were full and could not withhold more people with COVID-19. So my question is, how do we identify what is real news that we should actually consider and what is fake news, and how do we go about stopping the spread of incorrect information?
Yeah, so that's very important, the difference between fake news and information that changes over time. So yes, it is true that in the beginning, as I said, this epidemic is very young. It's only been with us since December last year, and so we're learning all the time. And so the issue of how the virus is spread became evident when we started to see cases of COVID-19 being infected, people being infected in closed areas, people being infected from singing, and people being infected in restaurants when there was movement of air, and began to see that this could also be spread not only via droplet, but also by airborne transmission. And that was a very important scientific finding, because it helped us understand the importance of ventilation and to make sure that we started to avoid crowded conditions and congestion, and to limit our interaction with people because of the issue of airborne transmission. And so as science understands the virus more, and as we gather more data about how transmission occurs, new information will arise, which may either replace the current information or disprove the current information, much like we heard about the reinfection, that we didn't think people could get reinfected, and in fact we've been proven wrong with this. And now we will have to understand the immune response and the immune system. And so there are things that are logical, like airborne transmission and droplet transmission, but there are things that are not logical, like drinking bleach. And we all know that if you drink bleach, you can get very sick and you can die. And so we also have to trust our own instincts about things. You know, some things, you know, just sound crazy, and we know that is false. You know, that would harm us if we had to drink weird concoctions to protect us. But things like this, but things like the immune system, and will change, and we'll learn new things all the time. We also have to be careful about claims. You know, we have heard claims even from Donald Trump about medicines that work. So even presidents can spread fake news, and so we have to be careful about key opinion leaders saying things, particularly when they're not scientists. And we have to always make sure that science is protected. So we can't have presidents of countries saying, oh, we're going to rush to register this drug or rush to make this vaccine available without the right data, because we have to, first of all, do no harm and make sure that whatever we put into people is safe, and that the information we get is reliable and reproducible. So that's a very important thing. And I guess with an epidemic like this, there's always going to be a lot of hype and a lot of hysteria, and you know, we have to try and distill fact from fiction. And I think the important thing about fake news is to continue to see what if it's verifiable. So very quickly, when fake news comes out, we do see people talking about this is wrong, or this is right, or we agree or we disagree, and then always then to look for the signs So, and to rather look at the science, rather look at the data before we make conclusions about certain things. So it's a very important thing. And there will be lots of conspiracy theories. I've heard conspiracy theories as well, as lots of claims for cure that are incorrect.